Hello and welcome back to GP Video Podcast by Nadia. So today we are still talking about colorectal cancer that we started yesterday. So if you remember, our alimentary tract or our gastrointestinal tract starts from the mouth, pharynx, esophagus, stomach, small intestine, large intestine, rectum, anus out. So large intestine and rectum are the parts that can grow colorectal cancer. It is the fourth most common cancer diagnosed in Australia and the second most common cause of cancer death in Australia. So for symptomatic individuals, what are the symptoms? Like alternating diarrhea with constipation, abdominal pain, bloating, and blood in the stool, along with weight loss, anemia, pale, iron deficiency, and night sweats, and all that kind of symptoms, either together or few of them, warrant investigation. Investigations start with the normal blood tests, fecal occult blood test, which is the screening test for colon cancer. Then if needed, CT scan and or colonoscopy. So this is for symptomatic individuals. But when we talk about the screening program, this is usually for asymptomatic individuals with or without family history, because a colorectal cancer can be simply symptomless or signless. So what is the screening program? We'll have a look at that today. So for that, we categorize people into three risk categories: average risk, moderate risk, high risk. What is average risk? So first of all, we are clear that the screening program is only for asymptomatic people. For symptomatic people, we have to do proper investigations, which is bloods, scans, fecal occult blood test, colonoscopy. But now we are talking about asymptomatic individuals and how we should be detecting colorectal cancer in them, because a colorectal cancer can be purely asymptomatic. Okay, so the people who are average risk are asymptomatic, definitely, with no family history, or one first degree relative or second degree relative with a colorectal cancer starting when they were more than 55 years of age. So age is very important here. The average age of diagnosis is 69 years for colorectal cancer, but in the screening program, please pay attention to it, because age is very important, because these days youngsters as young as 31, 32 are being diagnosed with colorectal cancer. So average risk people are, number one, asymptomatic for sure, with no family history, or one first degree relative or second degree relative with a colorectal cancer being diagnosed more than 55 years, when they were more than 55 years. So what do we do for them? The screening program for them is a fecal occult blood test starting from 45 years to 74 years every 2 years, and no colonoscopy is indicated. Okay, so today we spoke about the average risk people. Average risk people are asymptomatic with either no family history or one first degree relative or second degree relative with colorectal cancer diagnosed in them when they were more than 55 years of age. So in these patients, what's the screening program? Starting from 40, so previously the age was 50, but we can take it lower as down as 45. So starting from 45 years of age, every 2 years, a fecal occult blood test up to the age of 74 years. And after 74 years, we can stop screening them. So that is about average risk. Tomorrow I will talk about moderate risk and then high risk. See you then.